Hello and welcome to Season 2, Episode 43 of the Physician Assistant Exam Review Podcast. This week, we're going to continue with dermatology, talking about bacterial skin infections. My name is Brian Wallace. I'm the host and creator here at Physician Assistant Exam Review. Over on the website, www.physicianassistantexamreview.com, you can find all of the notes and all the information right over there on the website. So if you'd like to follow along, a lot of people do. If you'd like to just go over there as you listen, it's a nice way to visualize the things that we're talking about at the same time as you're hearing them. And all of that's available under the blueprints. I think it's blueprint in the upper right-hand corner of the website. You can click on that, and everything should be pretty well organized down below that for you. This week, we're going to be talking about dermatology. We're going to continue our discussion with derm. Specifically, we've been talking about different types of infections last time we talked about fungal infections, and this week we're going to be talking about bacterial skin infections. It's going to be a relatively short show because I want to keep that in mind. I want to keep just that one section together. Next, we're going to cover exanthems and some viral reasons for skin disorders, but I didn't want to mix the two together. I wanted to keep everything sort of neat and clean, so this show's just going to be a little bit on the short end, in favor of simplicity when you're listening and keeping things into just one topic. And that being said, let's jump right in today with our priming questions. Which is a deeper infection, erysipelas or cellulitis? Which is a deeper infection, erysipelas or cellulitis? What key term is associated with impetigo? What key term is associated with impetigo? And our last one, what two organisms are most commonly associated with skin infections? What two organisms are most commonly associated with skin infections? Great, so let's jump in and start talking about cellulitis. Number one, so we're going to do cellulitis, erysipelas, and impetigo are our three topics for today. Again, we'll bang through those pretty quick and starting out with cellulitis. Cellulitis is a bacterial infection of the skin, deep dermis, and then you can get down into some fat a little bit. It's most commonly caused by Staphylococcus and Streptococcus. Certainly other things can cause it, but those are our two primary concerns. Clinical presentation, patients are going to come in with warm red skin. It's going to be tender. If it's worse, they're going to get fever and chills. So basically, you get this area of the skin that is warm red and sort of painful. And it's usually a clinical diagnosis based off of what you see. And once you've seen it a handful of times, it becomes pretty obvious. You can get a culture in some cases. My wife had a pretty bad case of this a long time ago. We'd gone to the beach, and I think she got bitten by a horsefly or something weird. So she had a little puncture wound in her skin, and you need some sort of break in the skin, generally speaking, to get an infection. And a couple days later, she wound up with this nasty infection. It was all red, and this growing pattern of redness, basically. So it's well circumscribed, but it's not even. It's not like a circle. It just sort of spreads out from that initial infection point. And hers got so bad that you actually had a little center of pus that they could culture, but normally a culture isn't going to be all that helpful. It's a clinical diagnosis. And typically these are easy enough to treat. They usually use some sort of like doxycycline or cephalosporin, something like that. And if you need to be admitted for IV, then you use cephalosporins. But it's a pretty straightforward management. The one thing I would point out, and we definitely did this for my wife, is you can draw around the outer line of that redness. So you take a magic marker like a Sharpie and you outline that area of redness. And the reason for that is you can see then if that red is going to continue to march outward or if it starts to shrink and if the antibiotics is working. It's pretty cool to see because it's so obvious. But you can easily in a couple of days lose track of how big the infection used to be, and you can think you're getting better or worse. So marking the outer borders of it is helpful. Erysipelas is next. This is similar to cellulitis, but it's a little more superficial. This is most commonly caused by a group A strep, which is the same most common cause as strep throat. So this is a bug that's all over the place, right? Clinical presentation is a rash, usually on the face. And then again, similar to cellulitis, it's a warm red, kind of swollen rash that may be painful. These patients can have very high fevers. And treatment here, IV antibiotics are recommended in most cases, which may include doxycycline and cephalosporin, just like before. Treatment response is good. However, without treatment, sepsis is likely. And then the last one I want to talk about for today is impetigo. This, again, is usually caused by Staph aureus or Strep pyoderma. So staph and strep again. Transmitted by skin-to-skin contact. And typically predicated by abrasions or bites. And then I always remember this because it may appear with poor hygiene. And the one time I saw this on was when I was a student. It was in the emergency room, and we had an elderly, demented patient who had a really classic case of impetigo. So it really stands out in my mind, that poor hygiene and that the way it looks on the face. So it looks like these groups of vesicles, the vesicles leak and then produce these honey-colored scabs. Or you can get bullous impetigo, and in that case, you get these bulla, which are bigger versions, basically, of those vesicles. They're yellow, golden, they rupture, and then you get those honey-colored scabs. It's basically just that the material from within the bulla then comes out onto the skin and scabs over and dries out. And again, I keep saying honey-colored scabs because that's the key term associated with impetigo. And what you want to do is think about, how are we going to differentiate impetigo from everything else? Well, unless I describe this particular pattern and how these patients come in with this sort of crusty presentation, then it's really hard to differentiate them. So that's one you definitely want to highlight, definitely want to keep in mind. That goes into our key term list. Definitely something that's in the final step with the key terms in there. Labs and studies. Again, this is a clinical diagnosis. Cultures could be useful if you culture that material, but you really don't need them. Treatment in this case, most of the time, is going to be for a minor infection, is going to be mupirocin, which is a topical antibiotic, also known as Bacterial, and an oral antibiotic for a more severe infection. In this case, decloxacillin. But there's a whole host and a whole list of those that we don't necessarily need to go into, but certainly just getting the idea, understand the basics here. So that's our discussion for today on bacterial infections and skin infections. Again, really quick, really simple. I want to make sure as you hold on to those, keep them separated in your brain. You want to compartmentalize all of these things into these separate little rooms in your brain so that you can hold on to them. And if you just lecture on and on and on, everything sort of runs together and you start to forget them. So I don't want that to happen. So we're going to keep this short and sweet today. Let's jump right into our study tip for today. Is going to be very, very simple. Something that I think is going to help you a lot, but is very, very simple. And that's going to be to stand up. Stand and move every once in a while. I know when I was in school, I would spend 6-7 hours sitting in a chair, head down in my books. Something I've discovered since living where I'm living now, I like to be up in the kitchen, on a kitchen counter with my books out, whatever I'm working on out on the counter. I also now have a stand-up desk, which is really pretty cool because it goes up and down as I desire, which I really, really like. But it's not even that important to have something like that to make it work. I looked into a whole bunch of things. They make these cardboard fold-out desks that go on top of your desk, so you can put your laptop on top of those. They're not that expensive. And then I sort of realized that was all kind of dumb. What I wound up doing was just standing in the kitchen at the kitchen counter. Kitchen counter height isn't too bad. So I would work at the kitchen counter a lot, especially when I was studying for my PANCE. I would spend hours and hours at the table, but then I would walk around the kitchen. I'd spend hours just standing. It gets the heart flowing a little bit better, gets the blood flowing a little bit better. The shift in position is helpful in itself, but being up on your feet adds a little kinetic energy to what you're doing. It adds a little, a different sense to what you're studying. So one of the things you'll see is, or at least for me, I would find when I'm reading on a test question and I come across something and I remember what it is, but I can't come up with the word. And I can remember when I think about it, the pages it was on. And I can remember, that page was frayed a little in the corner, and on the other side, there was a picture of this. And I can remember all those details about where I last saw the term I'm looking for, and that helps me to come up with the term. So there's a lot of work that's been done that says the more senses you use when you're trying to remember something, the more clearly you'll remember it. So being up in a little bit different environment will make that information stand out a little bit differently than everything you go through sitting in the same seat. So even just moving around to different seats will help separate out some of that information. That's, again, one of the reasons why I'm cutting this episode short and not giving you all about the exanthems today, is because I want this section to stand out specifically in your head. I don't want you to associate those two together. I want this drive, this walk, wherever you're listening, to be associated just with bacterial skin infections. And I think that'll help you recall them down the road because you have them in their own little room in your brain that's associated with this episode, with this time that you're listening. And I think that makes it much, much easier to pull them out later on. And as you know, learning this stuff is step one, right? You need to know the information and understand it. But step two is being able to pull the information out of your brain. That's the hard part. Lots of people are good at learning the information. That's not easy, but at least it's part of it. But then the next step is pulling the stuff out of your brain, reading those test questions and being able to use that information you have. So if you can't remember it, if you can't pull it out, you might as well not have learned it in the first place, right? So we want to use all these different cues to help us remember. So by standing, one, you increase your heart rate. You get a little bit of motion involved, which just helps the blood flow and helps your brain work. But two, being in a different position, in a different place, gives your muscles a little bit of memory for that particular subject that you're studying in that particular place. So I want you to go ahead and give that a try. I think you'll start to see it clearly as you start to take different exams and practice with it and play with it and see if that helps you to pull certain things out of your brain that you otherwise may have forgotten. So spend a little bit of time at the kitchen counter with your books and your notebooks open there. All right, let's hit our priming questions and wrap this show up. Which is a deeper infection, erysipelas or cellulitis? Erysipelas or cellulitis? And the answer is cellulitis. What is the key term associated with impetigo? What is our key term associated with impetigo? That's our honey-crusted lesions or honey-colored scabs. Pretty much whenever you see something that says honey-colored, I can't come up with, and someone's going to email me and tell me that I'm missing something, and that's fine. I cannot come up with an instance where the term honey-colored is used anywhere else in the entire lexicon for the PANCE or the PANRE. What two organisms are most commonly associated with skin infections? What two organisms are most commonly associated with skin infections? Staph and strep. So that's pretty straightforward. So when you need to learn the antibiotics to treat a skin infection, a dermatitis, bacterial dermatitis, you're going to want to use something that covers staph and strep. So to me, I don't spend a ton of time learning and memorizing each in particular treatment. In this case, maybe the Bacterial for impetigo, because that's a little bit different. But for everything else, you just need to get something that's going to cover staph and strep. And you should be able to pick that out of a group, right? So your teachers may, if you're in school, they may give you open-ended questions where you have to write something in. But as far as the PANCE or the PANRE are concerned, it's all multiple choice. So you just need to be able to pick out the one that covers staph or strep. Now it may get more. It's possible that they're a little more annoying than that, and they give you two, and you have to pick the best one, and that's frustrating, of course. But to me, knowing that I need to treat staph and strep, and then picking out the antibiotic that has that is going to get you 90% of the time the right answer. So I would focus on that if I'm going through this material. A quick shout out to Maggie, who emailed me saying that she took her test yesterday and thinks she did really well using the final step as her one of her things. But she had used it for the PANCE and now for the PANRE again, and wrote in that she thinks it really helped. So hopefully she passed her exam. I'm hoping to find out soon. And congratulations to everybody who took their exam this week. And remember, just taking the thing is a big accomplishment. Passing it secondary, getting in there and taking it, that's the tough part. Most of you will do great on it. So I'm just proud of you when you go ahead and pass it and then take it and then pass it and let me know about those. So congratulations to those of you who have done that this week. Anybody who is taking it soon, good luck to you. And I would look forward to talking to you guys again in 2 weeks. One thing before we quit for today, I did have somebody email me asking me for discounts on the final step. the book I wrote. That's the 1,200 key term questions. And you can find that over on the website, www.physicianassistantexamreview.com. And as far as discounts and things go, definitely if you're not on it already, check out the email list. First of all, I put out emails every single day. Well, 5 days a week right now, but I try to do every day. And it's all just tips and tricks and ways to study better, ways to be smarter, ways to do better on your exams, ways to do better in school, ways to do better with just about everything. But also, those are the people who find out about the different sales I do. I do sales relatively frequently at this point. I put different things up. I challenge people with different ideas. I make different products available. All of that you're going to find over on the email list. That's where you're going to get all of that information. Those are the people who are going to find out about all of that stuff. If you're listening to the podcast, that's great. That's amazing. This is where I provide all of the content, the medical terminology, the medical ideas. That's where I cover all of that. But over on the website is where it's a much more personal experience. At least I have a lot more fun with it. We share a lot more. We talk a lot more. We cover so many different things. But also, if you're interested in picking up any of the things that I offer at discounted rates, at special packages, all that stuff, anything that new that comes out, definitely those are the people who find out about it first. So I strongly recommend that you hop over there. You can easily get on the sign up for the emails over on the website. Again, www.physicianassistantexamreview.com. And there's plenty of opportunities for you to sign up for it over there. And you will also get the entire chapter, the cardiology chapter from the final step with all of the questions from there. So you can take a look at that and use those as you go through medicine or as you get ready for your exams. That's absolutely just for you. All right, so that's all I wanted to wrap up with today. Take care, and I'll talk to you soon.